Can I say, first of all, I'm delighted to be here alongside Ivan Lewis, our Minister, this morning, and I want to thank Neil and Sir Cyril for hosting this morning's meeting. Neil, Sir Cyril and the King's Fund as a whole have, in my view, been extremely influential over recent years in many of the changes that we have made and are discussing on social and healthcare policy. And in particular, the King's Fund has raised the profile of social care, making the case for reform. So I'd like to start by thanking all of you here for your contribution to this debate, and by paying tribute to all of you here, charities, NHS workers, local government leaders, trades unions, all represented here this morning. I want to thank you for the work you do that is literally transforming the lives of thousands of people all over the country. I do believe that this morning's event is truly important. It's the opportunity, as Neil has said, to address one of the most significant and far-reaching challenges now facing Britain. It's how best in the long run to provide care for a population that is living longer and, quite rightly, demanding better care in old age or where there is disability. And that's why today the government is publishing a consultation document setting out the challenges we do face and why we must now look again at the options for reforming our current system of care and support. First, as I think everybody here knows, our current system needs to respond to the new pressures, financial, demographic and otherwise. Thanks to better healthcare, new technologies and a more prosperous society, we are all living longer. Life expectancy has increased by around 11 years for both men and women since 1948, and children today have the prospect of spending a third of their lives in retirement and seeing their own children retire. At the same time, advances in medical science are enabling people with debilitating conditions to live longer and more active lives. And all this represents progress and success. It's a cause for celebration, but without radical reform, the provision of care and support throughout later life and through periods of serious illness and disability will make even greater demands on both informal carers such as family and friends and on the care system. There are now more than 15 million people in England with long-term conditions ranging from chest disease to heart failure and, of course, the after effects of a stroke. The average man now spends 9 years living with long-term limiting illness compared to 6 years in 1981. About a third of all men and a half of all women upon reaching the age of 65 will need long-term care and support as they approach the end of their lives. As a result, we expect 2 million more people to have care and support needs in 20 years' time. Our second challenge is that the current system does need to be more personal to people's needs and to their aspirations as individuals, and to deliver the high standards of service people now have a right to expect. Now, quite rightly, people's expectations have risen in recent years. A generation of older people have shown that they can lead healthy lives well into retirement. With the right support, they can remain active and make full contribution to their society. And people with even severe disabilities have shown that the services which they need most and appreciate most are those which empower them and enhance rather than diminish the control they have over their lives. So our care services need in future to be more responsive to rising demands for personal care and for independence. We must make it easier for people to be cared for in their own homes so that far fewer people have to move out. We must do much more to give family members and friends who provide care the support they deserve to give it. To achieve this, we must therefore put real power and control into the hands of the users of the service, giving them the independence we know they want to make their own decisions about their lives, as we have done with personal budgets. And the third challenge, it's essential that in future there is fairness to those who work hard and save for retirement. We know that differences in entitlement between different areas of the country create uncertainty and anxiety for people when they are most vulnerable. Now, there is no easy solution, but measures which succeed in supporting frail older people in their own homes for as long as possible will certainly help. And this can be matched by a greater use of personal budgets which allow people to get the care that they want and decide to have. But we can and must look to give people the opportunity and the support to save for their old age in a way that ensures them and protects their houses and their inheritance. So these are, in my view, the great challenges we face. I believe that now is the time to look at how we can create a new social care and support system fit for this 21st century. A service that is personal to individual needs, giving real control to those needing care and their carers, that values the informal care and support on which our society depends, that gives people who benefit from it access to care in their home, offers us all protection against the costs of care in old age or as a result of disability, and builds a new relationship between the individual, the family, the community and the state. There are a wide range of options for reform, and I'm sure there will be plenty of debate and discussion between now and the end of the year. This is the 60th anniversary of the National Health Service this year. It is clearly the case that this is one of the great concerns and challenges of the future that we have not as a society fully addressed. I believe it would be a great marking of the 60th anniversary of the National Health Service if we could, over these next few months, make great progress on resolving some of these and addressing and resolving some of these matters of social care. And I look forward to us all working together to do so. Ivan has set out a process of consultation. This is not a sort of ordinary debate. This is a serious debate around the country involving large numbers of people, thousands of people over the next few months. And I hope you'll all continue to play your part in this. I'm learning a lot, as I have done today. I think the challenge is clear for us. I think the solutions require a huge amount of work and discussion, but I've no doubt with the ingenuity that is shown here and the creativity that is shown in thinking about the future, we can all make a contribution to resolving one of the great issues of our time. Thank you very much.